physiological phenomena describes the ability of deoxygenated hemoglobin to bind with carbon dioxide more readily than oxygenated hemoglobin, particularly in tissues with low oxygen levels. So what is this phenomena known as? Yes, Haldane's effect. So Haldane's effect and Bohr's effect, both of them are very important, and you will get some questions pertaining to it. What is Bohr's effect? Bohr's effect basically means that affinity of hemoglobin to combine with oxygen, it is inversely proportional to the concentration of carbon dioxide and to the concentration of hydrogen ions. So if the affinity reduces, if the concentration of carbon dioxide increases, or if the hydrogen ion concentration increases, that is the pH reduces, in that case, the affinity of oxygen to combine with hemoglobin, it reduces, because this is inversely proportional. This is the Bohr's effect, because you can have a question pertaining to Bohr's effect also. Okay. The ability of deoxygenated hemoglobin to bind with carbon dioxide so that it can deliver the carbon dioxide back to lungs is Haldane's effect. In a hospital ward, you are reviewing a case with a team of healthcare professionals. The patient, a 55-year-old man, has been admitted with severe joint pain and swelling due to rheumatoid arthritis. During discussion, the attending physician poses, given the patient's inflammatory condition, how does the body typically deactivate prostaglandins? So again, in this question, the question is basically, how does the body deactivate prostaglandin? But they've given you a big clinical scenario just to intimidate you. So don't get scared of such big questions. So what's the answer in this case? Oxidation by cytochrome P450 enzymes, it basically occurs in cases of some drugs or in cases of some xenobiotics. Hydrolysis by prostaglandin dehydrogenase, this appears to be the correct answer. Conjugation with gluconic acid in the liver or phagocytosis by macrophages in the spleen, this doesn't make any sense. Conjugation with gluconic acid in the liver, this is basically for excretion of drugs. So this is not for hydrolysis of or deactivation of prostaglandins. During late pregnancy, what is the primary source of cholesterol production in the fetus? So late in pregnancy, where is cholesterol synthesized in the fetus? In the placenta. And in the adult, where is cholesterol synthesized? In the liver. During embryonic development, at what specific day does cytotrophoblast begin to form? So trophoblastic cells, they can give rise to two types of, they differentiate into two types, syncytial trophoblast and cytotrophoblast. And this usually happens by day 5 to 6, the differentiation. And it is by day 8 that the cytotrophoblastic cells, they begin to proliferate. This is by day 8. In embryonic development of female reproductive system, at what point does lower two-third of vagina originate from sinus vagina bulb? So again, the embryology of vaginal development becomes important. So upper one-third of vagina, it develops from the lower part of the paramesonephric duct. Upper one-third develops from lower part of paramesonephric ducts. And the lower two-third, it develops from the fusion of sinovaginal bulb, which arise from the Mullerian tubercle. This is unrelated to the question. The reason I'm taking it here is it's very important. You may get a question pertaining to this. Also, what is important is that this is endodermal in origin, and paramesonephric duct, this is mesodermal in origin. So these can be separate questions. And lower two-third, this is the fusion of sinovaginal bulb, which form a vaginal plate. And later this plate gets canalized to form the vagina. And what is the time when this lower two-third of vagina, it originates from the sinus vaginal bulb? That is week 8. Because the sexual differentiation usually occurs by week 12. Next question, during labor, a 37-year-old woman with gestational diabetes undergoes continuous monitoring via cardiotopography. The CTG parameters are as follows. Baseline heart rate of 130 beats per minute. Accelerations are present. Variability of less than 5 beats per minute for 50 minutes. Decelerations, typical variable decelerations observed in more than 50% of contractions for 30 minutes. Contractions occurring 3 to 4 times in 10 minutes. Based on this assessment, how should the CTG be classified? Again, you will have, I think, around 7-8 image-based questions, and one of the image-based questions would be either an ECG or a CTG, or maybe a urogram, which you have to analyze. So CTG interpretation becomes important, and you have to basically in a CTG look for 4 things: heart rate, variability, accelerations, and decelerations. Now, based on whether these parameters are reassuring, that is, they are normal, or they are non-reassuring, that means in that case, it could come in the suspicious category, or they are abnormal. So that I'll not take. It is mentioned very clearly in your course manual. You can go through it. How, what are the parameters where it becomes reassuring, non-reassuring, or abnormal? And if all these 4 features are reassuring, then the CTG becomes normal. If one of the features is non-reassuring, then it becomes a suspicious CTG. If one feature is abnormal, or 2 or more are non-reassuring, then it becomes a pathological CTG. Now, in this case, if you come back to the question, you will see that the heart rate 130 beats per minute is more or less normal. Accelerations present, that is also normal. Variability less than 5 beats per minute for 50 minutes. What is the normal variability? It should be between 5 to 25 beats per minute. So this becomes one non-reassuring feature. Decelerations, typical variable decelerations observed in more than 50% of contractions for 30 minutes. This is of not much significance. Contractions are also fine. So these parameters are more or less fine. This one is one which is non-reassuring. So there's one non-reassuring feature. What kind of CTG does this become? It becomes a suspicious CTG with one non-reassuring feature. So coming to the next question, what is the most suitable test for a 32-year-old woman with painful periods for 7 years and primary subfertility for 3 years despite normal pelvic ultrasound and semen analysis results of partner, while her serum follicular stimulating hormone level is 6.8 international unit per ml and luteinizing hormone is 6.7 international unit per ml. So in this case, the first feature, the semen analysis is normal, the pelvic ultrasound is normal, and her follicle stimulating hormone FSH and LH also appear to be more or less normal. So what is the next thing which you want to test in this case? So if FSH and LH are normal, most likely the ovulation is also occurring normally. So next step, what should you do? You should do a laparoscopy and tie test to rule out any tubal blockage. Yes. What happens to the cardiac output in the second stage of pregnancy? Again, the changes, the physiological changes which are occurring in the circulatory system, what happens to the blood volume, the heart parameters, very important from perspective of MRCOG exam. Now, what happens to the cardiac output in the second stage of labor? What happens to cardiac output during pregnancy? Anyway, it increases. But what happens to the cardiac output during second stage of labor? It further increases because the second stage of labor, it involves pushing. So that causes the increase in cardiac output further. By how much? Nearly by 50%. In the first stage, the cardiac output might increase only by 35%, but in the second stage, because of active pushing and delivery of the baby during the second stage of labor, the cardiac output may increase as much by 50%. Which molecular technique is commonly used for diagnosis of cystic fibrosis mutation, including the detection of deletions, duplications, and other genetic variations? So cystic fibrosis, the cystic fibrosis transmembrane conductance region, that is the gene which needs to be tested. So how do you test that? That is through the next generation sequencing, because this will give you the complete structure of this gene and you will be able to see if there are any deletions, duplications, or any other genetic variations which are there. In a clinical scenario involving newborn with ambiguous genitalia and suspected congenital adrenal hyperplasia, the medical team considers genetic testing for diagnosis. Where is the chromosomal location typically identified for the most common mutation associated with congenital adrenal hyperplasia, crucial for genetic evaluation of the condition? So for congenital adrenal hyperplasia, what is the most important mutation which could occur? And this affects which enzyme? This is typically 6p21. That means short arm of chromosome 6, the P arm of chromosome 6 at locus 21. So the region 21 of this short arm, this is the place where the mutation occurs, and this affects 21. So 21 alpha hydroxylase is the enzyme which is affected. That could be a separate question, that which enzyme is affected because of this mutation. Coming to the next question. A 30-year-old female seeking advice on contraceptive options, the physician discusses the unique characteristics of drospirenone, a progestin commonly used for hormonal contraceptives. What special characteristic of drospirenone, known for its special effects, should be considered when prescribing hormonal contraceptive to the patient? So when do you prescribe a contraceptive which is containing drospirenone, something like maybe Yasmin, to the patient? When do you do that in your clinical practice? When you want to take control of the androgenic effect, PCOS, right? The patient is suffering from hirsutism or facial hair or acne. In that case, you give her Yasmin, which contains drospirenone. So drospirenone has anti-androgenic effects, and that is why it will prove to be useful. A clinical case of lower limb neuropathy, a 55-year-old patient presents with symptoms suggestive of obturator nerve dysfunction. The healthcare provider suspects a specific origin of nerve involvement. From which combination of nerve, spinal nerve roots does obturator nerve primarily originate? So what is the origin of obturator nerve? Ventral rami of L2, L3, L4. Again, you should remember this for femoral nerve, for sciatic nerve, obturator nerve, pudendal nerve. All these are important. They will definitely ask what is the, and these are like, if you know the answer, you know it. You don't have to think about it. So in this question, coming back to this question, because they do not give any option where you have L2, L3, L4. And major contribution is from L3. So the option which is L2 and L3 should be what is correct. Because between these two, L2 and you will say it can be L2 and L4 also. Because they haven't given any option which contains all three of them, L2, L3, L4. So the major contribution comes from L3. So the best answer would be option B. In a clinical case of suspected Cushing's disease, a 45-year-old female presents with symptoms including weight gain, moon phases, and thinning of skin. Upon further evaluation, the healthcare provider suspects a hormonal cascade contributing to her condition. Which hormone exhibiting the initial abnormal increase ultimately leads to elevated cortisol levels in Cushing's disease? So Cushing's disease is obviously associated with elevated cortisol levels, which is occurring because of what? Yes, increased level of ACTH. In a clinical context focused on reproductive endocrinology, a physician discusses the molecular structure of key hormones involved in regulating menstrual cycle and fertility. What unique structural feature is associated with GnRH among these hormones? So GnRH is typically a decapeptide. What is the probable diagnosis for a 32-year-old pregnant woman for the first time presenting at the maternity day unit at 34 weeks gestation with complaints of palm itching and blood tests indicating elevated bile acids and alanine aminotransferase levels? So again, this is a easy question comparatively. Yes, it is obstetric cholestasis. Obstetric cholestasis, again, important from perspective of MRCOG exam. And this will be basically associated with a triad of 3, which includes pruritus. There is elevated bile acids and abnormal liver function tests. Characteristic feature of obstetric cholestasis is there is no rash, but there is intense pruritus or itching in the palms and soles. So this is important in this case because there might be a question which particularly says that there is a rash or there is no rash. So you will be able to make out what the condition is based on that. Why is obstetric cholestasis important? Why is it important to detect this condition? Because it can result in some complication. What is that? It can result in preterm labor and very uniquely, it can also result in, yes, IUD and that also late IUD. So you may face an IUD at 38 weeks, 39 weeks, 40 weeks. So late IUDs and preterm labor. So sometimes there is a suggestion that maybe you deliver the patient early to prevent this. But as per UK guidelines, there is no recommendation that you should deliver such patients earlier, prior to 37 weeks. But you should take care and not extend the pregnancy beyond 37 to 38 weeks. That is something you should take care of in these cases because they are typically associated with intrauterine death towards later part of gestation. So what factor primarily determines the strength of magnetic field in context of MRI technology, which is crucial for producing detailed images of internal body structure? So how is the strength of magnetic field in context of MRI determined? You know there are electromagnets in MRI, and the strength of electromagnets depends upon what? It depends upon the magnetic permeability of the material, because greater is the permeability, for example, iron or steel, they have high magnetic permeability, greater would be the electromagnetic strength which will be produced. Next question, which is how is 95% confidence interval calculated for sensitivity and specificity in diagnostic testing? So how do you calculate a confidence interval? So what is the formula for calculating confidence interval? Now this is, what is the formula for confidence interval? It is mean plus or minus Z value into standard error of mean. Now, what is the Z value? And what is the standard error of mean? Standard error of mean is standard deviation divided by n, square root of n. N is the sample size. It could be n or it could be standard deviation divided by n minus 1. Whatever gives you a whole number and you don't get value as decimals. Now, what is Z? This is the value of confidence level. For example, in this case, it is 95%, the confidence interval. So if you consider the standard deviation curve, or you consider the Gaussian, the normal distribution curve, or the Gaussian curve, then you see that within one standard deviation, you will have +1 and -1 standard deviation. You have 68% of population. And within +2 standard deviations, you will have 95% of population. This is not 2 standard deviation. This is actually 1.96, which is equal to 2. So within 2 standard deviations, you will have +2 standard deviation and -2 standard deviation. 95% of the population will die. And if it is 2.58, or you can say almost 3 standard deviation, +3 standard deviation and -3 standard deviation, you will have 99% of the total population. Now, in this case, you are asking about 95% confidence interval. So Z value becomes 2. So this becomes mean plus or minus 2 into standard error of mean, which is standard deviation divided by n. So you can also have a question where they ask you to calculate the confidence interval. So you should know how to do this. So coming back to the question. So how do you calculate the confidence interval for sensitivity and specificity in diagnostic testing? Calculate the standard deviation of the test results and subtract a margin of error. This is also wrong. Using a software program specifically designed for statistical analysis, through a complex mathematical formula involving the binomial distribution and the sample size. This is also not correct. Utilizing the Wald method for proportion estimation, which considers the estimated proportion, sample size, and a standard error of mean. Yes, this is what the formula comprised of: the standard error of mean, the sample size, and the estimated proportion. The estimated proportion was the Z value. Then, by visually inspecting a graph of the test results and identifying the range within which most data points fall. This is also not correct. So the answer becomes B. So coming to the next question, a 35-year-old female presents with abnormal uterine bleeding and is undergoing a diagnostic evaluation. During a pelvic examination, the healthcare provider observes distinct cell morphology within the uterine tissue, which may provide insights into the patient condition. Which term describes the cells in the uterus characterized by their spindle-shaped appearance? Again, this is a very simple question, but they have tried to make it a very complicated one. So what is the answer in this case? Yes, this is the myometrial cells. The characteristic spindle-shaped cells in the uterus is the myometrial cells. Among the various types of degeneration observed in fibroids, which degenerative process is most frequently encountered in postmenopausal women and is characterized by deposition of a protein substance within the fibroid tissue? Again, a simple question. Yes, this is hyaline degeneration, and this is characterized by deposition of hyaline within the fibroid tissue. Red degeneration also you may get a question. So make sure you know about red degeneration also in depth. In our clinical scenario, a 60-year-old female patient presents with urinary urgency, frequency, and nocturia. Upon further evaluation, the clinician suspects detrusor overactivity as underlying cause of her symptoms. Which receptor type predominates in the detrusor muscle, playing a crucial role in mediating bladder contraction? So what kind of receptors are predominant in the detrusor muscles? It is the M3 receptors. What percentage of individuals in the United Kingdom population possesses Rh negative blood type, a crucial factor in healthcare settings and blood transfusions? It is 15% of population is Rh negative, and that is why Rh isoimmunization becomes an important topic in the MRCOG exam. What is the frequency range typically used for ultrasound imaging? So there can be variations of this question. They can ask you the range used for transabdominal ultrasound. What is the frequency? Or for TVS, they can ask you. The TVS, the frequency range is higher, and for TAS the frequency range is comparatively lower. So in this case you have to consider both, so this becomes about 10 megahertz. So which is this nerve which is indicated in yellow in this anatomical diagram, and what is the primary function? And if you see, this typically shows that the nerve which is delineated in yellow is supplying the clitoris. So what nerve is it likely to be? Because this is typically supplying to the clitoris and not to the inner thighs or to the medial muscles. So it is unlikely to be obturator muscle or the ilioinguinal nerve which supplies the inner thighs. If they would have shown the pudendal nerve which typically supplies the perineum and the external genitalia, they would have shown you from its origin, that is S2, S3, S4, the sacral region, then it goes into the gluteal region. It emerges below the piriformis muscle and then it moves into the greater sciatic foramen. There it lies medial to the ischial spine, then it moves into the lesser sciatic foramen, and from there it leaves the gluteal region and moves into the pudendal canal, which is on the lateral side of the ischiorectal fossa. And then it finally divides, it gives rise to three branches. One is the inferior rectal nerve, and it divides into two branches, which is the dorsal nerve of clitoris or penis, and the other is the perineal nerve, the superficial and the deep branches. So if they would have shown pudendal nerve, they would have shown its path of pudendal nerve is also very, very important. And that is why I'm taking it here. It can come as a question. It can come as an image-based question also. They can ask you about maybe to mark the sciatic notches or the pudendal canal, or they can ask you which structure is passing through this, through these structures. So this is obviously not pudendal nerve also. Dorsal nerve of clitoris, most likely it is dorsal nerve of clitoris because they typically highlight clitoris and the nerve which is supplying clitoris is what they are trying to show. Genitofemoral nerve supplies sensation to the upper inner thigh and femoral region. Genitofemoral nerve will lie below the inguinal ligament and not above or through the inguinal ligament because it is above the inguinal ligament. So most likely it is the dorsal nerve of clitoris. Coming to the next question, what anatomical structure is situated within the urogenital diaphragm is primarily responsible for maintaining urinary continence by voluntary contraction? Again, an easy question. This is external urethral sphincter because this is located within the urogenital diaphragm and forms the floor of the pelvis. And this helps in contracting, and this muscle, it contracts voluntarily and it prevents the flow of urine through the urethra when it contracts. And when it relaxes, the urine will flow through. Which anatomical structure forms the inferior boundary of the urogenital triangle and serves as the attachment site for bulbospongiosus muscle? So what is the urogenital triangle? This is the urogenital triangle, and anteriorly you have pubic symphysis. Anterolaterally you have the ischiopubic rami, anterolaterally. And posteriorly, you will have this transverse perineal muscle. This is posteriorly. So you'll have to imagine it in a three-dimensional structure. And the inferior boundary is formed by the perineal membrane. And that divides the urogenital triangle into the superficial perineal pouch and the deep perineal pouch. Again, the structures through each of these pouches are also important, so make sure you know them before your exam.